Over the past 10 years in Ireland, there's been a trebling in the amount of sexually transmitted infections, also referred to as STIs, in Ireland. Young adults under 30 have accounted for over half of these sexually transmitted infections. Now, just to let you know, over 40s, there's also been an increase. So it's not just young people that sexually transmitted infections affect. Sexually transmitted infections can be transmitted from one person to the other through vaginal, anal or oral sex, and also through genital skin-to-skin contact. Now, the problem with an awful lot of these is there's actually no signs or symptoms. Now, what I'm going to go through is I'm going to give the names of the various STIs that are out there and just put them into different categories, just that people will know their names, and I'll just give a little bit of information on each. So first of all, we've bacterial infections. So the bacterial infections that are out there are chlamydia, gonorrhea, syphilis and non-specific urethritis. With the bacterial infections, there is treatment and they can be cured. We then have our viral infections. So our viral infections consist of HIV, genital warts and genital herpes. Now there's also hepatitis, but if you'd like more information on hepatitis, we have another section on our app. In relation to genital warts, genital herpes and HIV, there is treatment to suppress the symptoms, but there's no cure. We also have our parasites, and our parasites are scabies, pubic lice and trichomoniasis. Now with scabies and pubic lice, you are going to know you have them. There are symptoms, you'll be itchy. You can go to your local chemist, you can get a lotion and they'll be gone within 24 hours. You may become reinfected. The other thing with both scabies and pubic lice is they're not necessarily sexually transmitted. They can be transmitted through close bodily contact. Trichomoniasis then is sexually transmitted. So with that, you will need to go to your doctor and get treated and get diagnosed. Now it may be treated with antibiotics. So because it's a parasite, there may be symptoms of itching and it can be quite irritating around the genital area. So the main thing to remember is that if you have an STI, that you do go to your local STI clinic and get treatment. You can also use condoms, which if they're used correctly and consistently, they're the most effective way to prevent the transmission of STIs. This is why it's so important to know how to use condoms correctly. So if you'd like a condom demonstration, we do have a section on our app that will show you how to do that. So I'm just going to mention two more, and that is thrush and bacterial vaginosis. Thrush is a fungal infection. It's not sexually transmitted. 3 out of 4 women will have thrush at some point in their lives. Men don't normally get thrush, but if they do, the earlier detected, the better. Bacterial vaginosis then is not fully understood. It only occurs in women, and if you do have symptoms, it will be an unusual discharge. Again, with this, you need to go to your doctor to get treatment, and normally there will be antibiotics that you'll be given. Remember, if you're diagnosed with an STI, don't panic. You've taken the first step in making sure you get proper treatment and that you do not pass it on to anyone else. In the future, go for regular STI checks. Good sexual health means making sure you have the knowledge, skills and ability to make informed sexual choices, and that you act responsibly to protect your health and the health of others.